Hello, everybody.
Hey, Lisa.
Hi, Lisa.
It looks like we've cleared the waiting room. If you want to go ahead and start, I counted 3 members logged in.
Okay. Let's see, Dee, Eva, myself. April, we know won't be here. All righty. Well, hello, welcome. It's good to see everybody, especially after the faux pas of our last meeting. I had it on my calendar for 3:30 and not 3 o'clock. So imagine my surprise when I tried to sign in at 3:30 and nobody was there. I'm like, what happened? And I've apologized about 500 times, so I'm still feeling bad about it, I guess. I'm eating easy guilt. But it's nice to see you all again. It feels like it's been forever. Welcome to TAC, our October TAC meeting. Have we had an opportunity to review? Are there enough of us? Is Jen on here, Wiseman?
I only counted the 3 of you, but with 5 members, I believe 3 should be enough.
Okay,
But
oh, that's right.
I'll need
That'll
you to
work.
turn her camera on to vote.
Okay. Okay, we need to approve June, August, June, July. Yeah, we need to approve June and August. Look at you, Dee, with your hair up. I wouldn't have recognized you.
I'll go ahead and make a motion that we approve the minutes from June and August.
Thank you. I can second.
And I can vote yes too.
It's unanimous. Okay. So moving along, we do have some additional questions for Dr. Stone. So Dr. Stone, I'm going to kind of let you take over at this point, if that's okay with you.
I will unmute and then I will just ask these as a follow-up. I want to preface what I say though by sharing just a little bit of the reason for some of the concerns related to the services that we're providing. And my first question has to do with COVID. COVID testing and vaccines are listed as covered services or allowable services from the federal government. They're not included in the TAC that was updated and has recently been posted. We've requested that they be included. The concerns that I'm raising about that are that, first of all, come January, school districts aren't going to have access to free COVID tests from the federal government any longer. And even with the free test, I know there are some districts who've had to purchase tests. They wouldn't be, the test itself wouldn't be billable if it was purchased with federal dollars, but the service would be billable. And so school districts won't have any way to support ongoing testing if that funding is not continued on a federal level past that time. And we are still experiencing several significant issues related to the pandemic. And then from an equity standpoint, there's a concern because lots of our families do not have access. They don't have private insurance. They might have Medicaid, but they don't have transportation. They don't have access. And I can share specifically from the district where I work in Jefferson County, we have vaccination rates, double vaccination rates of students against COVID. Some of our schools have 0% of students double vaccinated, all the way up to 82% in our more affluent areas. And so I just raised this as a concern because it's our children living in poverty by and large that are behind on vaccinations, and that's our Medicaid eligible kids a lot of time. And so I wanted to ask, about why these services haven't been covered is my first question.
Anybody?
I apologize. I'm flipping through to see who's on.
Hi, this is this is Justin Derringer from the Department for Medicaid Services. Having some technical difficulty here, but can you all hear me?
Yes, sir.
Okay, good.
Mhm.
That is a issue that we are currently talking about. We're dealing with our pharmacy branch, talking to our pharmacist about the different requirements related to federal COVID tests, and then the testing codes, and also vaccinations, and getting those codes aligned, because we cover those things in some of our provider types and not in others. And so we're trying to kind of see how we can get those things more accessible to schools and school-based services before the January date. So we're working on that, and hope to get out some more guidance within the coming weeks.
Thanks, Justin. And then I wanted to ask just about the technical assistance guide. Really, I want to understand the process. And you all are probably talking about this internally already as well, but with the expanded billing being new, but the opportunities we have in Kentucky are so, we have a lot of opportunities in Kentucky, I'm sad to say. And I just want to make sure that, or see what we need to do to request to have service providers in on those discussions, because the folks who are boots on the ground are going to provide some great information. And I just want to see, is that happening, or what are things we can do to help encourage that?
So we've got a new employee that in that area. Her name's Erica Davis. I don't know if she's on the call right now.
She's
Miss Davis,
phenomenal, by the way. Yeah.
she is, yeah.
Mhm.
But Miss Davis is working on two different projects right now. One of them is the TAG, the Technical Assistance Guide. The other one is a multi-phase, multifaceted approach to education and promotion of these services in multiple school districts statewide. A lot of these school districts don't take full advantage of the school-based services programs now. And so she's working on a large promotional initiative with a lot of educational material, training materials that she's put together from various states and other national organizations. And so those two projects that I think I had previously talked to the TAC about, maybe that wasn't quite ready yet to share, and maybe we got that mixed up with the Technical Assistance Guide. But I'll talk about the Technical Assistance Guide just a little bit. That guide is a joint guide that is comprised between us and the Department for Education. The Department of Education has that, reviews it, and sends it to us, and we review it before that's kind of collaborated and put together. I know that we get some assistance from when we looked into who actually uses that guide, and it was primarily used by the contracted services and entities that are billing services and entities by the school districts, not necessarily the school nurses. And so we get some assistance from those contracted entities currently. However, I think it's a great idea to have school nurses provide input on that as a stakeholder in the process. We've already discussed it and seen where we can kind of fit that in the process for the next edition, next update. So we will definitely have a stakeholder review period for the next Technical Assistance Guide, where we allow various members of the school nursing committee or the school nursing community to put their opinions and advice in. We're going to try to send that to as many individuals as we can, just to get feedback and kind of comprise that and review it before we put that out for the next edition. So it was a wonderful idea. I apologize that we weren't able to kind of get that done before this current edition came out. But anytime you gather stakeholder input, it's kind of like with administrative regulation. You have a varied group of stakeholders, and gathering that feedback can be time consuming, and then going through all that feedback and looking at each issue and how it relates to everything that we have going on. It can be a time consuming and very involved process, which is great because it improves the quality of the product. However, it just requires more time. So that's absolutely going to happen for the next edition. Didn't happen in this one, and I do apologize for that. But moving forward, we hope to include that.
Thank you. I appreciate your all's feedback on that too. And Dee and Lisa, I don't know if you've got anything to throw in there. I don't want to do all the talking. The only other thing I wanted to ask about was, or just maybe a statement, and Justin, you've already mentioned this, but I just want to say, with the changes that have come with the increased opportunity for billing, what we have found in our district, our data and research department has been helpful in looking at our data, particularly as we work to address inequities. And we know that our kids that are behind on their preventive health exams, so we look specifically at kindergarten and sixth grade, but we know when those kids haven't had physicals, they, when we've run the analysis, there are also students who are not performing as well. We do, in our district, we do an assessment. It's called the Measurement of Academic Progress, or MAP testing. We do it 3 times a year. And those students who are behind in those things are more likely to be not at the same level as their peers, and they're also likely to not be growing at the same rate of their peers. And we have also found the exact same thing for children with chronic health conditions. We look specifically at, well, all health conditions we looked at for their MAP assessments. And so, you know, our opportunity to do more partnerships between health and education are just excellent right now in the state. And I think Kentucky can really lead the nation in this work. And I just hope it's something that, especially as we work on equity issues, that we'll continue to do that. So thank you for your response to the questions. We appreciate your work.
Thank you. Absolutely.
So if I could just ask a question, and this is going to go back up the agenda just a little bit regarding COVID vaccinations and the disparity or inequity between our vaccinated populations. I'm trying to understand why we think there's, how we can impact that difference. I mean, they had so many free clinics and things available. Do we think we've not made enough effort to get them out into the schools or into specific areas? Is that an area or a potential area for impact? Or you think there's a lack of education?
I can tell you, Lisa, what we found here.
Uh-huh.
So we offered, and that's when the state still had the partnerships with the entities that would come to the schools. Those partnerships are gone, by the way. So we can't find
That was
anybody
my next question.
willing.
Okay.
Yeah, we're having to do any COVID clinics that we're doing for students and staff right now is because we as a school district became providers for that. And that's not the case with school districts around the state, but we can't get anybody to come into our schools anymore to offer vaccines. But even when we did last year, we have 155 brick and mortar schools here in Jefferson County, and we had clinics at every school. We had at least 2 clinics. We had weekend drive-in clinics, and then we held clinics at every school. We held them during the school day. And we did lots of vaccinations. There were over 10,000 vaccines given within our schools last year, but they were given not to the kids that we were trying to reach the most. And so we got a grant from the Kentucky Association of Health Plans, and we did some very targeted clinics for our, we have a school for middle and high school students who are new to the country, and their vaccination rates are, I mean, even 2 years ago, only 40% of those children even had an immunization certificate, let alone be up to date on their vaccines. And so we did very intentional outreach at that school and in 2 zip codes in the city where there are lots of kids who are immigrants and refugees. And we scheduled the clinics. We had them on the weekends. We provided interpreters. We paid for transportation. We did phone calls to every family in those locations, and we used the language line. So we would talk to them in the language that they spoke at home. And what we learned from those is one is word of mouth was a big deal. So when people came to the clinic, they would start calling each other, but we still didn't do a very good job of getting to the students, to the children. And so our vaccination rates were just very challenging. And I can't help but think some of it is because of the disparities that have existed and the difficulties that people without transportation and living in poverty and all those things have had historically, that there's got to be a lack of trust. But we got another grant this year from the Kentucky Association of Health Plans again, and we were able to offer $20 gift cards to children for being vaccinated. And that was one of the questions that I had asked about, how can we share with families how they can access the incentives that they are eligible from their managed care organizations, because we vaccinated close to 200 students at the 2 clinics that we've had at Newcomer Academy by offering that incentive gift card. So that's been the most successful thing that we've done. And now we're trying to again, we called every family. We had all the information translated. We really did a lot of outreach just to try and build that trust. And so now we're trying to just cycle through the schools based on the level of student vaccination for COVID.
Well, my brain's been churning a lot, and we've talked a lot in this particular group about maternal health and well-being and midwifery and students and their well-being. And I've been a nurse for 38 years, and the entire time I've been a nurse, we've talked about the need for preventive health and health maintenance. And we know as professional caregivers that it starts with our children and our mothers and our family unit. And it just seems that as a community, we could do better. That as a team, this is the group that could help us to do better with maternal health. And once we get them born healthy, how do we keep them that way?
Listen, your points are because when we are successful in reaching parents, I mean, what we found in the schools where we have school-based health centers, that if we can normalize healthcare for the children, the parents are more likely to access that, and parents will do things for their kids. And so, I think you're right. I think building that sense of community when it comes to healthcare,
and that sense of trust in the healthcare system, so that you go for wellness and not just when you're sick. Because we also know, those of us who have been working in the system for a long time, that those same populations that lack trust and don't do preventive health are on their last legs when they finally do come see you. Just like the moms, if they don't get maintenance and healthcare when they're pregnant, by the time they come, they're eclamptic, they're sick, and at very high risk. My wheels have been turning ever since we had a KNAC meeting today too. So trying to look at how best to guide our forces. And it keeps to me my brain keeps coming back to the family unit and the children and the moms and how we can best, because you could sit here all day as a team and come up with a lot of great ideas, but you have to focus, on where your greatest impact could be. And I
Yeah.
think our kids are it, our moms and our kids are it. So
I can tell you that last year when we did all the COVID testing in the schools, I mean, we did a lot of COVID testing in Jefferson County. I mean, we had COVID at every school building had COVID testing once a week. And there were drive-through sites open every evening. And we averaged, just for students and staff, about 25,000 tests per week. But when we would do those school clinics and the kids would really take charge of coming to get their COVID test, and sometimes they would swab themselves, and it was powerful to see, because they were empowered to do self-care, to recognize that they're doing what they can. And they would say over and over again, I want to do what I can to protect my family.
mhm.
And
Very powerful.
and so the just the mental health impact is
Mhm.
huge. But yeah, it's powerful, because that's how we normalize wellness and taking care of ourselves and others.
Yeah.
Let's see. The APRN recommendations, Dee, wasn't that something you had asked about? Okay.
Yeah, the ball is in the court of DMS, because
Right, that was taken to MAC
the MAC,
2 meetings ago.
that was in May.
I pulled
Okay,
that
right,
up and
right.
those responses were sent out to you guys. But if you have not received them, I'll send them back out to you after the meeting.
Okay.
There's not been any return or follow-up from DMS about timeframes or moving forward with not only the APRN reimbursement of 100% of the physician fee schedule, but also for any kind of reimbursement for certified professional midwives who are governed by the Kentucky Board of Nursing. So we're still hopeful that the conversations will continue, but it has been taken to the MAC, and that was their recommendation to DMS.
And DMS did respond. If you're not happy with their response or want to follow up, I would recommend, since you have a quorum today, to make another recommendation to the MAC that is upcoming in November. I believe November 17th is the next MAC meeting.
Is it too soon?
No, ma'am, since this is your meeting that you have before the MAC, that would be my recommendation, that you make those recommendations again if you would like a follow-up on that.
So I could recommend that we as a TAC have the MAC inquire to DMS about the status of those two recommendations, which were the 100% reimbursement for APRNs and the reimbursement for services for the Medicaid population for the services of certified professional midwives.
Mhm. I agree.
Same.
So I guess we have a positive vote.
I'm sorry, this is Justin Derringer again with DMS. I did want to state that we have moved forward with progress on the 100% reimbursement for APRNs. We have been in talks with trying to complete that, and the change orders have been put in. Don't have any exact dates, but that change order has been processed and approved and is in place to be put into effect.
So are you sure that that's for all APRNs, or is it just for the nurse anesthetists? the CRNAs.
Let me check and I'll get back with you because I'm not 100% sure. I have to go back and reread the change order and see if it specifies exactly if it's all APRNs or if it's just certified registered nurse. And I'm not sure. Let me double
So
check that because I don't want to misspeak.
It was my understanding that the regulation was in front of the administrative regulation review committee on Tuesday, and there was it passed that committee, and it's to go to another interim joint committee before the session begins, and that's just the CRNA I guess wing of APRNs. It wouldn't be all APRNs, is my understanding.
All right. Yeah, let me check on that to clarify.
Thank you.
That is correct. The 907 KAR 1104 only addresses CRNAs. We are, I can only speak to the scope of that regulation, but it does not synchronize APRNs to physician payment levels.
I was trying
Thank
to
you,
go through
Jonathan.
our
I wasn't
notes
sure if
and
you were
look.
on or not. I appreciate it.
So I think that our recommendation can go to the MAC to follow up on APRN reimbursement and CPM reimbursement.
Sounds good, Dee. And we already voted on that, so we're good.
So we move forward with the conversation to MAC then, correct?
Correct. We just
Because we still
recommend-
need an answer to our question.
Well, we have the recommendation from MAC to DMS, and DMS has given their response, which is we need to look into it. And so
And our
Our
response
nursing
is, where are
TAC
we now?
would be
Right?
to the MAC. So we would recommend to the MAC that they follow up with those recommendations from May. Assess for any movement or discussion by DMS.
Okay. So we're all on board with that. And again, MAC meets November 17th. Make sure that's on our calendar. D, make sure that's on your calendar. Absolutely.
So do you want to move on to new business?
Absolutely.
Did
Another
you
absolute.
want- Did you want to hear from the MCOs? They should
Oh,
be
yeah.
prepared
Yeah.
to discuss
Yes,
your
please.
full
Sorry.
business item. No, it's okay. Do I have anybody from Aetna on, and do you need to share your screen? Okay. Do I have anybody from Anthem on? And do you need to share your screen?
It's Stephanie with Anthem on here, and yep, I would need to share my screen, please.
You should now be a co-host, Stephanie. Thank you. And I apologize. Did you say you were with Anthem or Aetna?
Anthem.
Okay, thank you.
Yep, can you guys see my screen just to make sure?
Not yet.
Okay, let me try that again. And I'm just going to the bottom and hitting the share screen, correct?
Yes, ma'am.
Okay. Oh, okay, I see it. Let me do this one. And now maybe?
Not yet. Stinky.
Okay, hang on. I mean, it gives me like a million options, so I'm trying to pick okay, let me,
If you can't get it to work, Anthem was kind enough to send it to me in advance so I can pull it up.
okay. Is it working now? I clicked on the screen that showed the PowerPoint.
It's not.
Oh, sure. If you want to pull it up, that would be fine. I
Yes, ma'am. Give
appreciate
me
it.
just a second. It's thinking about opening it. I apologize.
No worries. Sorry, I couldn't share my screen.
And of course, my laptop wants to start freezing. I do.
Oh,
apologize. There we go.
okay. Do you want me to try again?
Can you see it?
Yeah, I can see it now. Thank you. Okay, and so this is our member incentives that you guys wanted to know about. So you can click on to the next slide, please. Okay, and so before we go into the member incentives, I just kind of want to step back and show you guys kind of our work model, which focuses on whole health and kind of with layered in health equity. So we kind of have a continuous improvement cycle that you can see there that we go through with the data and assessment. So really looking at our member level and state public health data, stratifying our Anthem membership, identify health equity and population health priorities and goals. And then we kind of go into where we collaborate for change. So we engage with community organizations and stakeholders. We commit to community investments. We implement, and then through our process, continuous quality improvement, we implement targeted interventions to improve individual and community health and equity. And then we monitor and evaluate the progress against the priorities. So through this continuous cycle, Anthem determined that we had 8 domains of focus that you can kind of see listed there at the bottom as we really assessed our members, the state's priorities. We came up with behavioral health, cancer, COVID immunizations, chronic conditions, dental, maternal child health, substance use disorder, and social determinants of health. Those are our 8 domains of focus. And as we go through the presentation, I think you'll see that we worked hard to embed these 8 areas of focus into our member incentives. So we really are trying to use this model with our member incentives and education along with our provider education and our provider incentives, so that we kind of they really focus on those 8 areas. Next slide, please. And then obviously, navigating healthcare benefits, it is challenging. So in October of 2021, we implemented a new member orientation meeting that meets monthly, and that continues to occur. And that meeting is really designed to help members have a place where they can understand all the different benefits that we have, because lots of people view a health insurance plan as just paying their claims and providing coverage, but we offer so many more extra benefits. So this is a meeting that they can go to that is truly an orientation that kind of walks them through that process. So as you can see here, each meeting is allotted for time for in-depth benefit and plan explanations to make sure that the members really have a good understanding of the information that's presented. There's a lot of different agenda topics. There's a few of those slides are from here, but I did not put, this is, the rest of these slides are going to be specific to member incentives, but the slide for the member orientation, that presentation, talks about insurance terms, so very common, insurance terms, member ID cards, health benefits, covered resources, how to access those. And then it also goes into all the extra benefits like value added benefits, healthy rewards, health risk assessment, talks about the member website and mobile app, member services and how to access those. We provide those in English and Spanish, and the members are also given an email address so that they can reach out if they have any questions about, that they have after the meeting or that they weren't able to ask during the meeting. And we have a variety of ways you can see listed there of how to, to let the members know about these monthly meetings. We send out quarterly newsletters to our community partners in the Mark Your Calendar section, and that has details and a registration link. There's a member text campaign. It's posted on our Facebook page and the Anthem Medicaid blog. And then members are provided with a, once they've registered, they're provided with a WebEx registration link. And you do not have to be a new member. It says new member orientation, but you can be an existing member as well. You do not have to be a new member. Any member can attend these meetings. And okay, so slide 4, thank you. And so this slide just goes into kind of reviewing and signing up and redeeming the awards. The members are rewarded for, this is our Healthy Rewards program. They just sign up once, and then every year the Healthy Rewards program continues to go. And the Healthy Rewards, all the kind of preventative types of services and immunizations. They get they can pick from a variety of gift cards, from a master gift card to Amazon Health and Wellness, Walmart, all the different TJX brands. The members sign up by calling member services, or they can sign up so they can call, or they can sign up online at our anthem.com Kentucky Medicaid site. They can also call the Healthy Rewards toll free and learn exactly what they're eligible for. And then just want to call out here at the bottom, the eligibility is based on activities that happen 30 days before their enrollment and activities that occur after. So for providers on the phone, we just want to make sure that you encourage patients to enroll in Healthy Rewards, prior to having any of their health screenings or immunizations. Next slide, please.
Can I ask a question, Stephanie?
Sure.
So so they sign up for Anthem, but then in order to be eligible for incentives, they have to actually enroll in this program?
That is correct.
And
yes.
is the enrollment questionnaires? Is it, what process do they go through when they get online to fill that out, or when they call and ask about signing up? And then and my third question with that is, if they don't participate in the orientation, do they get notified about the opportunity to enroll?
Yes, they're still notified. They don't have to go. That is a relatively new program, October 2021. And I am not in now. I don't know if Amanda's on the phone. That might have our marketing director. It's her team that presents, that does the new member meetings, orientation meetings. And I don't know, Vicki, if you're aware, if of how detailed it is for them to sign up. I think it is just a matter of either calling and getting signed up that way, or going on to the member website and signing up. But you are correct, they do have to sign up in addition to being signed up with Anthem Medicaid. It is a separate sign up on the portal, or calling either the toll-free number through Healthy Rewards or the number that was listed on the previous slide. But I do not know the details on how they do that, but I can get that over to you guys.
Yeah, that would be great. Just
Sure.
to know what the process, what they have to.
And I think that in the new, this is already a fairly long slide, so I'm pretty sure in the new member orientation presentation, the PowerPoint, it kind of goes through and has, specific directions for them. I just didn't want to put all that in here since I was focusing on member incentives.
I asked that because it's, we've had a lot of families that are afraid to enroll their children in Medicaid because they're afraid of repercussions on a federal level. And so that's why I asked what kind of questions they're asked, you know, what they have to do to enroll.
To enroll, okay. I don't, Vicki, you don't happen to know what questions they're at, what questions are on the enrollment form, do you? I don't.
It's
think that-
okay, you can.
Okay, yeah, I'll let you know.
follow up.
Yeah.
Oh, here it goes. It's really just about ensuring that if they have their ID card with them, just verifying their ID, you know, 3 identifiers basically, and then ensuring that they're eligible, they're still eligible. And then they put them in the program.
So did you say they 3 identifiers?
Yeah, like their name, they're just verifying that that is indeed the
Oh, okay,
member.
they're not having.
Yeah,
to
that's
do anything,
signing
You're
up.
just saying name, birthday.
Right.
Okay.
Yeah, right, exactly. So once they can verify that indeed they're an Anthem member who is eligible for services, then they're enrolled in the program.
Gotcha.
Yeah,
Thanks.
Yeah, thank you, Vicki.
sure. Sure.
And then I won't read, like I said, it's a kind of a little bit of a lengthy, so I won't read these. I just wanted to list the member incentives. The frequency of the member incentives is in the rate. And again, we tried to, if it ended up being one of our 8 areas of focus, you know, one of our 8 domains, we tried to emphasize that a little more, especially if we, you know, if our members aren't really seeking out those services, we try to increase the incentive on those. So next slide, please. So on here with the COVID, this is actually, I did make an update to this, but since you're looking at the one previously, it's not on here, but our COVID vaccine is now ages 6 months to adults. But you can see that we did a pretty, have that rate at 100 instead of 25 to really incentivize our members to get the COVID vaccine. Our postpartum rate was a little lower, so we wanted to really encourage members to do their postpartum visit, and that's really I know a priority for the state as well with the maternal mortality, which, you know, kind of happens after birth. So we increased that. That's now $50, as well as our HPV is $50 because there's a need there. You know, that's not, as you know, that's not an immunization required for schools. So we really, and then we're also encouraging the different education to both our members and providers around HPV, that it started age 9, the conversation, and that it really focuses on that it's an immunization that helps with, helps against 6 different types of cancer and make it a cancer conversation versus, the sexual conversation in the past. So there's we're in a, with American Cancer Society, we're in a 1-year kind of collaboration with them and have gotten a lot of good feedback from them as well to pass on to our members and providers. Next slide, please. And then this is the last, second to last slide for healthy rewards. So on this slide, I think we did increase maybe cervical cancer to $40. So again, just colorectal screening, $50. So just really trying to put higher dollars where we feel that our members are not getting those types of preventative services to try to entice them and incentivize them to get those services done. And next slide, please. And then this slide here as well with our initial health screener, which is able to give us a lot of great information. That is $50, tobacco cessation, $75. So just kind of, again, all the different member incentives, their frequency and their rate kind of listed out there for you. And then our next slide, we'll talk about value added benefits. These are kind of, there's just 2 slides on this. And this is around the kind of broken up into a couple of different categories, or like 5 different categories. List out our maternal child health, diapers, sleep safe kit, breastfeeding support kit, portable crib or car seat, stroller, organizer, books for babies, Boys and Girls Club memberships, and then our education and employment section there with gas cards and bus passes, no cost laptop, Jumpstart program, GED assistance, criminal record expungement, Lifeline phone, and our community resource link. And then next slide, we have our promoting healthy lifestyles there, wellness, and then opioid support. And again, these slides kind of did come right out of that new member orientation meeting. So again, that the members can see that, you know, all the different rewards, but instead of just listing them out, kind of breaking them down into different sections, we thought that would be helpful in case there's certain areas that they want to focus on. They could pay more attention than looking through a long list and maybe missing something. Next slide, please. And then to review and redeem the value-added benefits, I won't read through that, but basically they can log on to their benefits reward hub, you know, on the Anthem Medicaid site and walk through those steps. Or if they don't have access to the internet, if they call us, we can warm transfer them, or they can, you know, they can reach the CHIPS Reward call center so that they can redeem and review the value-added benefits if they need to. Next slide.
Are those phone calls available in other languages as well?
Yes, my understanding is, Vicki, do you know how many different languages? I know for sure we do English and Spanish, but do we, I'm assuming that we do languages outside of just those two for our, when members are calling in and if they don't have access to the internet? I'm pretty sure we have a system that does that, but I can get back to you on that as well.
Thanks.
And next slide.
Oh, yes, you would still, there is an interpreter service available. So yes, other languages could be utilized as well.
Okay,
Yeah.
I thought so.
Sorry,
Okay.
I couldn't get off of mute.
Thanks.
That's okay. I know it's hard to get
Double
back and forth. And I'm sorry, if you can go back to slide 11, I think that slide was actually the first one with our empowerment team. Oh, no, you're right. Okay. Thank you. So next is our, what we call our empowerment team. They really focus on the SDOH, you know, the social determinants of health. They're made up of a group of community engagement navigators, what we call CENs, and they're also certified community health workers. They assist members one-on-one with, you know, overcoming social determinants of health. Each CEN has their own designated region, which allows them to really know what services are available and be really an expert in their area. And the CENs utilize their designated regions to also schedule field outreach with community-based organizations, or CBOs, to educate the empowerment program and coordinate reoccurring opportunities with members in person. And then, you know, this also helps them develop a deep and meaningful relationship with those community partners. Next slide. And then this is just kind of a slide, sort of like the value-added benefits, that kind of just gives the different areas where they, you know, that they can help members with record expungement, help them take their GED. They can also help with housing for anybody that's experiencing homelessness or is at risk for that. We have a housing flex fund that we utilize for that. Next slide. And then they have community resource link, which is very good at letting our members know what's available specifically in their community. And then they work to, you know, do goal setting and planning with the member. So I just kind of know this isn't like exactly the healthy rewards or the value added benefit, but I felt like this is a value that we, you know, an extra perk that we offer at Anthem, you know, to our members who may be, you know, in a hard place with food or housing and, you know, those type of insecurities. So next slide just kind of shows the referral process. So members can be referred to that email or to the phone number. So we have internal referrals to this program. So our behavioral health case managers, our physical health case managers, our national call center, basically our member services. So, you know, the definite, you know, several, and there's other areas internally that can refer members to the empowerment team, and then external, any, you know, of our community-based organizations or external case management programs, members can self-refer into this. And so that just kind of is a little, you know, where the members kind of get a referral, and the referrals are picked up by the empowerment team, and then the members are walked through it again. They really work with them one-on-one in their community, and, you know, to help them with their specific need. Next slide, please. And then their process. So once a referral is received, the member is assigned to the appropriate CEN in their area. And then on initial engagement, the CMS The SDOH screener, along with our health risk assessment, is completed to identify any of their social determinants of health barriers that the member might be facing. And then once all those needs are identified, the CNN works with the member to set the goals related to those needs. And then utilizing those goals, the CNN works with the member to overcome, their barriers, and then, empower them, through these different services. And so again, the main goal is to empower members, to promote them, to get them to a place where they're back to being independent and self-sufficient, and help them prepare, for any other future needs that arise. And the last slide is just questions. That's all of our, healthy rewards and our value-added benefits, and then our empowerment team.
I don't have any more questions. Thanks, Stephanie. And these slides will be available, right?
Yes.
Yes, ma'am. I'll send them
Okay.
to you after the meeting.
Thanks.
And Stephanie, if there's anything else that you need to send over for the TAC, you can send it to me and I'll make sure they get it.
Okay, thank you.
Do I have anybody from Humana?
Good afternoon. This is Brent Wilkerson with Humana. Can someone just confirm they can hear me?
We can hear you. I've also made you a co-host if you'd like to share your screen.
Yeah, and Aaron, just to confirm, have you received, you should have received the materials from us as well ahead of the meeting?
I have not.
Okay, we'll be sure to get those to you and the TAC afterwards. And I think based on that, I'll go ahead and share screen.
Thank you, Brent.
Got some extra windows here, so I'm going to try to optimize. Can someone just confirm Humana's PowerPoint is on the screen and visible?
Sir.
Perfect. Yeah, so thanks for having us. Again, my name is Brent Wilkerson, speaking on behalf of Humana's team today. So we brought a few things. One, an overview of our healthy activity rewards for our members and all the incentives that we offer currently. And then the second slide is just an overview of how our members can engage with these rewards, can access the rewards and redeem them. So this is a PowerPoint 2 slides. We'll certainly send this after the meeting. We also have a PDF that's a more granular, detailed document of all of these incentives and again, how to access the incentives. That document is actually on our website as well, and it will always be linked there. Initially, just to talk about the process to maintain these rewards and incentives, we update these annually. While a lot of incentives will remain from year to year, we're continuously monitoring the utilization of our members and any gaps in care, and looking for opportunities to add incentives. And also just be innovative and unique with some of the rewards we provide our members. So these are 2022 award healthy activity reward opportunities. We've already finalized 2023, of course, and that's all part of our value-added services submission to the state for the next plan year. So just briefly, this is a summary view, as I said, to give you a flavor of the incentives we offer. You'll see here kind of grouped in categories: wellness and education opportunities, vaccinations. I know we spoke about a little earlier in this call, COVID-19 vaccinations. We have that reward once per year per member of $40. On the right side, screenings and exams that we have rewards for, and then preventative visits. While there are some submission requirements for a few of these, a lot of these rewards are tracked on our end via claims-based utilization reporting. So as members engage with Go365 and take action in these areas, we can on our end automatically apply these rewards. The other thing I'll talk about just briefly, when we talk about redeeming the awards, redemption of these rewards does occur within the Go365 platform, but also really the best way for members to engage with what is available to them is to go ahead and enroll in their into the platform to understand and see the incentives they have available to them, and they can track their progress throughout the year.
Brent, is that platform in more than one language?
I do not, I can take that back. I'm not certain that it is, but that's a good question.
Thanks.
So second slide here, just to level set on redemption of rewards. And I think this was asked in the Anthem presentation as well, but members do need to enroll in Go365 in the platform to get the benefit of the rewards based on their healthy activities. And so they'll do that by downloading the Go365 app from the App Store, depending on what type of mobile device they have. The sign up is pretty straightforward, verifying their identity and including their Medicaid member ID. Once members are registered, again, they'll have full functionality within that platform, and they'll be able to see what activities, what opportunities they have, as well as their status and any rewards they've already accumulated. And they'll also, in that platform, determine how they want to redeem those awards across a wide range of gift cards. We have got feedback from members and others in the community around providing additional ways to redeem awards, and we've got an offline process that we're rolling out later this quarter, specifically for COVID vaccine rewards. So allowing members to engage with our Humana customer service team and receive documentation via the mail to then submit proof of COVID vaccines to then take part in that reward without necessarily working from within the platform and the application referenced here. The last thing I would point out is the link at the bottom. All of this information is there, as well as a more granular view of all the incentives, because some of the incentives, there are of course age bands and other criteria that must be met. Sometimes there's an incentive where there's a total reward of say $50, but you can get that reward max over increments. And so all those details are in that more detailed document. Again, I'll share that document with this group, but it's also available within the link shown below. I'll pause there for any questions or comments.
Brent, my email's in the chat if you'd like to send those to me, and I'll pump them out to all the members.
Perfect. We'll get them to you. Thanks.
Michelle from Passport emailed me. She's having a little bit of trouble sharing, so bear with me just one moment and I will pull up their presentation while she presents. Give me one moment. I've got too many items open on the desktop. Can you see that?
Yes.
Michelle, were you able to? There you are. Okay. I believe you're still muted, Michelle. Looks like she's having just a little bit of trouble, so give her just a second. It's trying to connect to audio. Michelle, if you're connected, you're still on mute, ma'am.
All right, can you hear me now?
Yes, ma'am.
Oh my goodness. It's not even Monday. So I apologize for the challenge today. What Passport has is specifically focusing on the member incentive program. Passport calls that our Healthy Rewards program. So on the document that's shared on the screen, it's the green fields that are over on the left. Just to share a little bit about differences that we have than the Anthem and Humana programs that are previously discussed this afternoon. Members do not have to enroll in order to be in the Passport Healthy Rewards program. They are automatically eligible for Healthy Rewards as long as they are active Passport members and that Passport is their primary insurance. That being said, when they have a service rendered, when they get a COVID shot or when they go and get their mammogram, the Healthy Reward doesn't become automatically available. The member has to engage with us. They can either call, they can go online, they can submit an attestation form, or they can send something versus via hard mail, UPS, USPS. So they do have to engage when they close or whenever they do a preventative activity in order to earn the Healthy Reward. Otherwise, I think the program is very similar. The majority of the rewards are gift cards. There are a variety of stores that they can select gift cards for. Walmart is by far the most popular, but there's Amazon, CVS, Kroger, a variety of different gift card options. I think that Brent shared for Humana, the majority of Healthy Rewards are annual rewards. That being said, with the public health emergency ongoing, Passport did extend our COVID vaccine reward through the end of the year. So you'll see that there that adults can earn a $100 gift card and then children can earn a $25 gift card. I'm not sure if you want me to go through the individual rewards in any detail. There are maternal baby, prenatal and postpartum rewards. There are chronic condition rewards like managing your diabetes. There are preventative screening rewards like mammograms, pap smears, that kind of thing. There are well child and well adult getting an annual physical wellness visit rewards. There are rewards for dental. Trying to see what else I'm missing. Oh, and there's also in 2022, we added a new reward to get for members to engage to do a health risk assessment so that we could really see what was going on with them and their families and try to identify if they needed additional services. So that's where we can look specifically if there might be a social determinant of health need, food insecurity, housing insecurity, that kind of thing. So that assessment gives us an opportunity to address whatever those needs are that might normally not come to the attention of the MCO.
Gotcha. And then this, my same question, forgive me, but like this information, is it mailed to them? Do they get, something that shows them this reward opportunities when they enroll? And is it available in multiple languages?
It is. It's available in the member handbook, so they get it every year. It's available in their new member kit. We reference it in the member newsletters that go out at least 3 times a year. The children get birthday cards, And so as part of the birthday cards, we lay out the specific wellness activity that's appropriate for their age, and it references the rewards as well. It's available online. It is readily available in English and Spanish, but when they call in to customer service, we can get them translated versions in other languages upon request.
Thanks.
Sure.
Any other questions?
Thank you so much. Sorry for my technical difficulties.
Do we have anybody from United? Do we have anybody from WellCare? I do have United slide that they sent me in advance, so I'll send that to you guys. But nobody is here to present, so I'll pull the agenda back up.
Thanks, Erin.
Can you see the agenda?
Yes.
Yes, sorry, I was muted. Okay. I believe under new business, we're at D again, right?
Yeah, I just wanted to report to the TAC that the federal CMS recommendations to allow for certified nurse midwives to directly admit to hospitals has been in place. And recently, the Kentucky regulations were changed to allow for that alignment with federal regulations. So it basically puts the decision to admit into the hospital's hands, and they can decide if they want in their bylaws to have certified nurse midwives directly admit instead of admitting under a physician, which has been up until recently the process. So that's been a big change in the Kentucky regulations. So that's all I wanted to report out about that.
Can I ask a question, Dee?
Sure.
So is there data available yet? If it's a recent change, I'm going to guess you're going to tell me no, but I wonder if we're tracking that to see which hospitals are placing that barrier still.
That has just been changed in August, actually. So
Okay.
We don't have any data.
Thanks.
It's a good question, though. That's all I have, Lisa.
Just refresh my memory. What was the link?
It's in the agenda.
Okay, I mean, that's what that link is for specifically, right?
It just is to the announcement of the regulatory change.
Okay, I just making sure I was correct. Okay. Overview of the new health disparity and equity TAC, so we can understand the work of that group and DMS vision for improving health equity in the state.
Is Leslie Hoffman or Angie Parker on that might be able to assist with that?
Hi, Erin. I am on, but I think Leslie would be the best person to discuss that new tag. I can say that we've had one meeting, and I think it went well. Is there anything specific you would like for me to answer that I might be able to answer?
No, I think our interest was just in knowing the work of the TAC and maybe how that will relate to I'm sure how it will relate is reporting to the MAC as well, but what the department's vision is for this new TAC and how that impacts our work or how we can support that effort, I guess.
I think that's a very good question. And I think there could be additional information to come. Like I said, we've only had the one meeting, so we're still getting our feet under us on how best this TAC is and will work. If you want to put this on the agenda for the next meeting, we can certainly, and the minutes should be out on our website once they are reviewed and approved. And the agenda where all the other TAC meeting information is.
I can also send you the next meeting dates if anyone's interested in joining that meeting to listen.
Okay, when is that?
I believe it's November 4th, but I'd have to pull that up on my calendar. With 16 of you guys, sometimes my dates get a little jumbled, but I do believe it's that first week in November.
We get it. Yeah, if you could send them out, that'd be great.
That'd be
Absolutely.
great. Okay, thank you. I think we've already talked about the next steps for follow-up with the MAC. We've already had that conversation, and that is our APRN question. So we can move past that. IEP services are reimbursed at 70% to districts. What percentage are expanded billing services reimbursed to districts?
I can, and just for the TAC. So when school districts are reimbursed, so clinics and so on, when they bill Medicaid, the state pays their federal match. But for school districts and I believe health departments, and you all correct me if I'm wrong about health departments, but for school districts, the reimbursement is they don't get to keep that full amount. The state doesn't pay that federal match. And so they get 70 cents basically for every dollar for IEP services. Because that's what we're required. The state's required to pay back to the feds. For expanded billing, some of the nurses have shared that the reimbursement is 50%, not the same for the IEP services at 70%. So just wanted to ask if that's correct information. And if so, is there a reason that the reimbursement is lower for nursing services than it is for general IEP services, like for speech therapy and physical therapy?
Can anyone answer that?
Yeah, I'm not exactly 100% sure. I have to check and get back to you. So I'll get that back to you before one day this week.
Is this Justin speaking?
Yes, I'm sorry.
Yes.
This is Justin
Okay.
Derringer.
All right.
Yes,
Perfect.
absolutely.
Thank you, Justin.
You're welcome.
Justin.
Okay. Well, that was a good meeting. Certainly made up for last time. Anything else for the good of the group? Any questions, comments, anything that the team would like to discuss?
Lisa, I'm just wondering if there's anything from KNA that they would like to bring to the nursing TAC for any discussion or recommendation.
The only two things that I'm aware that keep coming forward from KNA is one, the APRN question, and two, supportive school nurses. So, but I certainly, because I missed the last board meeting because of work issues. My CNO is out on leave and I'm the acting CNO, so I'm juggling two jobs right now. So my schedule's a little wacky. So because of that, I missed the board meeting, this past board meeting. So Eva, were you at the board meeting?
I was not, but I can say, yeah, part of the governmental affairs, and D, there wasn't anything in addition to those items. I think there will be upcoming, but there was
Yeah.
nothing new since the last meeting.
Those are the two reoccurring topics.
I did want to let the TAC know that I followed up on your old data request from your last meeting. It is being reviewed. We've received the data and it's being reviewed for accuracy. They typically take between 60 and 90 days for that to come back out. So as soon as all of that is reviewed and approved, I'll get that information out to you guys. It was also very lengthy, so that it's just going to take a little bit of time to make sure everything is reviewed properly.
Thank you.
Okay, perfect. Anything else? Okay, wonderful. Thank you all very, very much for joining us today. Motion to adjourn?
I will make a motion.
Can I
And I'll
have a
second
second? Wonderful, wonderful. Thank you, everyone. Until next time.
Thank you,
You
everybody.
guys.
Have a great weekend.
Bye-bye.
Thank you.
Thanks,
You too.
Lisa.
Thank you. Bye-bye.